Hello, hello, hello. We are back. It's Thursday. Seems to come around fast these days. Um, it's our Thursday live lunch with Dr. D. I am your host, Dr. D. Let's just do some chatting before we start. Give people a chance to kind of log on if they're joining us. I switched it up on you guys. We talked last week about what we were going to talk about, and I thought there's been several articles that I've read, and of course in the news, we're still talking about opioids and the opioid epidemic and what we can do and how many people are being affected and all that stuff now. I just really thought it would be a good topic for us to kind of talk about. Obviously, it takes more time than what we really have. But that is going to be our topic for today. So, thank you for the people that have been tuning in every week. Thank you for your feedback too. One of the things that I did get feedback on is volume. So I'm hoping that you can hear me right now. If you can't hear me, let me know. So again, I'll give people a few more minutes to join us if they want. I hope that wherever you are tuning in, that you are warm and safe. I know this morning driving into work, I saw too many cop cars to count and several accidents just this morning. So hopefully you were safe with driving. I sadly am back in the north, so snow and cold weather and all that will be plaguing us for some time. And not much I can do about that right now. So just gotta find a way to enjoy it. Well, again, if you're just joining me, thank you so much for tuning in. I really appreciate it. Please feel free to leave any feedback that you would like, and that will be read by me personally, because this is for you guys, and hopefully you can share this information with someone that you know and it will help them. So today, again, we are talking about pain and opioids. And like I said, I chose this topic because there's so much of that in the news right now about the opioid epidemic, and I just really want to just kind of have a little discussion about it, okay? So the big thing I think I've said in my other live videos is that all of us at some point in time will have had pain of some degree. And right now we are in the opioid crisis. So there's tons of people that have been affected either personally because they have had opioids and become addicted, or someone knows a friend or family member that has been affected. That is pretty much 100% of the US population at this point, according to what they've been saying. So, what do we do about that? Well, I think some of it obviously is a little late to do things because it's already happened. But what we can do going forward is definitely make sure that now that we have this information, that we are actually utilizing it. So, um, I used to work for a pain clinic, I guess you would call it. And what I did not realize up until now was how prevalent the distribution of opioids was and how angry people get when they don't get them. I have had many situations where, in honesty, I actually feared for my life because someone wanted a specific drug and they needed to have it now. Obviously, this is with, um, doctors. We all take an oath that we will do no harm. And sometimes there's unavoidable harm that we do because medicines have side effects. You have to kind of weigh the good with the bad and go with what's going to be the most effective. Sometimes that is using opioids, but in certain situations. So, one of the reasons why I really wanted to hit this topic is because the last article that I read actually was talking about opioids and the combination with other medications, especially in population of people who are over 65, which the great majority of people that I take care of happen to be in that category. And obviously, as we age, we get pains and bumps and bruises. Sometimes we have, you know, major issues, especially from a surgery, a hip surgery. Well, I don't know about any of you, but when you have a surgery, sometimes Tylenol just doesn't work. The opioids themselves are not the problem, it's the use of them. Short duration of opioids, and we're talking about tramadol, Norco, Percocet, oxycodone, morphine. Those drugs are created to help with pain, but not pain forever. So here's the problem. When you take a medication, like a pain medication, there are receptors in your body that that medication actually connects to. And over time, the more you're exposed to that, the more the body feels, okay, we've had too much now. So it does what we call downregulate, or it takes away those receptors. And with that being said, you start to require more of that particular medication. Now, this doesn't happen in the first day or the second day. Usually, you start to have these effects when it's been, you're going on 2, 3, 4, weeks, months of this medication. That is when you develop this problem. That doesn't necessarily mean that you're addicted. It means that you're becoming dependent, which is different. You are dependent on the medication, but not addicted. The same way that you become dependent on, say, somebody always fixing your lunch for you. You're not addicted to that. You just have gotten used to it. And so you rely on that more than you did before somebody was fixing your lunch for you, right? That's where we get into a problem. Opioids are needed for short periods. You have a new surgical pain, you have a condition that cannot be treated, you've tried everything else. They shouldn't be the go-to, and that's the problem. Now, when it comes to people who are over 65, we're dealing with their pain, but also we're dealing with all of their other conditions. One of those is typically, and this has seemed to have affected women more than men, at least in the, I guess, people that actually admitted to it in the studies. But taking medications in the benzodiazepine class, so Valium, Ativan, people who struggle with anxiety, again, those are medications that you want to use for the shortest duration possible, but we end up having a problem when you combine them with opioids and you're over 65. It increases the risk for falling because Valium and Ativan, those are what we call sedative hypnotics. So they make you drowsy, they kind of put you in a nice, relaxed state, which is awesome if you're going to have an MRI and you get claustrophobia or, sorry, claustrophobic, or let's say you have a panic attack. Well, we need those. But for long term, there are other things that we should be doing because long term they do more harm than good. And one of the things that I found was interesting, it hasn't been 100% confirmed, at least in the studies that I've seen, is that those medications, the benzodiazepine class, the Valiums, the Ativans, the Klonopins, they actually have a larger potential, not a direct correlation, but they have a potential they are starting to see to either increase dementia or possibly make it worse, cognitive effects, people's having memory loss and things like that, which we see a lot in, over 65. So these are all things that we need to take into account. It's not just the opioids themselves. It's what else is going on in that patient. What else is going on with those medications and the combinations. People that have respiratory disorders, breathing problems, can be affected by the combination of those two drugs because they both can decrease your ability to breathe, the rate at which you breathe. Those are major things. So, yes, we have an opioid epidemic, and it's going to take all of us, doctors, nurses, patients, friends, family, loved ones, to actually go to find that solution. And on the flip side, help your friends and family that you don't need to take a pain pill a narcotic pain pill for everything. It's just not indicated. And in the long run, you do more harm than good. And I get it. Tylenol doesn't always work. It has its own limitations and side effects. So does ibuprofen and Aleve, all of those things. But as a society, we need to not be so quick to jump on those particular medications. Interestingly, there are actually natural medications and substances that you can use for pain. One of those happens to be turmeric because it's an anti-inflammatory. So I have used that in people with arthritis who couldn't take other medications. They can take turmeric because it's more natural, it's safe, and obviously everything, you still have to talk with your doctor and kind of go over the risks and benefits for you, but that's a medication that you can use. The other thing is actually in your diet. If you have a diet that consists of fast food, fatty stuff, sugar, all of those things cause inflammation in your body, in your joints. So you have joints in your back, joints in your arms, legs. You have a ton of joints. Fatty foods, sugary foods, those are going to increase the inflammation, and you will be more likely to have inflammation, which then starts the whole cascade of pain. Natural things are a good place to start. Does it work all the time? Absolutely not. There's no one way that will work to fix everything. But if you try other things, and again, let's say you are already taking things to help with your pain and then you have a surgery. Obviously, we want you to be comfortable in your recovery, but there's a balance. And I think that's the thing. The body likes balance, and we have to balance all of those things out with pain and comfort. You are not going to be 100% pain free. We want you to be comfortable. It's funny because when I was in residency, I had an attending who said, in a joking way, not to a patient, but in a joking way, that he appreciates the pain because it lets him know that he's still alive. Take that for what you will, but the point is that in our lives, we're going to have pain. Whether it be physical or mental, at some point we will have pain. It may not all ever 100% go away, but we can manage it so that it does not disrupt our lives. And I think that's the big thing. Opioid medications are helpful in certain situations, in short-term situations, small doses. But if you overdo it, now you went from one extreme to the other. And that's what we want to avoid. So I guess that's kind of my soapbox for the day, that we all live with pain, but let's encourage each other. Let's encourage our loved ones to not be so quick to take that opioid medication, not because per se of the opioid epidemic, but because we need to weigh the benefits versus the risks, weigh the side effects, and discuss it with your doctor, with your family, what's going to work best for you. Well, I think that is most of what I really had. Thank you so much for joining me. I would love to take any questions. If anybody has any questions or comments or concerns. Hi, Anthony McCoy. Thank you so much for joining me today. Please share this with your friends and family so that we all can have the knowledge to be able to manage things a little bit better so that we don't get into situations that involve epidemics. The other thing I was going to say too is, again, talk with your doctor. I think that's one of the things that actually was our second topic, was how to talk to your doctor, because this is a joint effort. The doctor has the information for you, and you as the patient have to tell the doctor the information so that together you can make a really good decision about what's going to be best for you. What foods can decrease inflammation? So I talked about turmeric, which is a spice, or you can get just a pill. Is very helpful. Things that have antioxidants in it, blueberries, actually things like olive oil. One of the studies that I've read actually described the Mediterranean diet as being really good for decreasing inflammation. Now, that was talking about the true Mediterranean diet and not just some of the things that we do here. But olive oil is one of the really big ones, and you have to be careful with that too, because there are places that are selling fake olive oil, unfortunately. That's basically a little bit of olive oil with a bunch of vegetable oil. But that's one of the really big ones that helps with inflammation. If you have joint problems and joint inflammation, there has been some information about pure bone broth, which you can make yourself, or they also sell in like the health food stores. And specifically for joints, that helps. Well, it helps for joints and gut, um, but it has a lot of the basic tissue properties in it. So it's literally liquid broth that has been taken from the bones of an animal, usually chicken or grass fed cow or something like that. You can make it at home yourself or you can buy it, like I said. But that helps because it has the collagen properties in it, which helps with joints and ligaments, and also helps with the gut, which is your immune system. Your immune system actually is in your gut. So you have that good bacteria that people always talk about. That's a good place to start. And again, a healthy diet, healthy, balanced diet, including proteins and vegetables. And proteins doesn't always mean meat for those people that are not meat eaters, but healthy proteins, healthy fats, vegetables, decreasing the sugar. Again, it's that balance that um, keeps everything intact, so that one thing's not kind of taken over. And that's a lot of what I try to tell my patients in terms of trying to get your food to help. A long time ago, before we had pharmacies and things like that, that's what people did. They were utilizing their foods as their medicine. And there's actually a colleague on Facebook who is a pharmacist, and she has basically created her own kind of specialty with food as medicine. And I think it's time that we get back to that a little bit. Again, I have nothing against pills, nothing against pharmacies. I think we need those things sometimes, but I think as a society we have looked at a pill to fix everything. And a lot of fixing our problems is going to be us taking some responsibility, taking responsibility for what we're putting into our body, what we're getting out of our body, and going from there. And the last thing that I will say about pain in general is the less you move, the more you will have pain. Now, that doesn't mean that if you're in pain, it means that if you are sitting still all the time, laying in bed all the time, that pain is only going to get worse. It's not going to get better. So get up and move. Get up and move, because exercise also is medicine. Again, within reason. Don't overdo it. If your doctor has given you instructions to be, you know, um, at home and only do certain things, please follow those instructions. But you need to move. Movement is good for you. It's good for your muscles, it's good for your bones, and it complements everything else that you're doing. Okay. Uh, what's her name? Oh, the pharmacist. Um, Jamie Hardy. Jamie Hardy is the lifestyle pharmacist. Let's see. I'm gonna type it. Okay. So I put her name in the chat so that you can look her up. I'm pretty sure she has a Facebook page where you can find out more information about her. I love what she's doing because, again, I just think that it's awesome. It fits with what I believe in terms of what medicine should be. Okay. I, again, thank you so, so much for joining me. I hope that this has been helpful. If you have any other questions, feel free to reach out to me. And I hope that you all have a good day. Stay safe, stay warm if you are someplace cold, and remember to live your best life because you only get one. All right. Tune in next week, same time. We're going to be talking Thursday at noon. Give yourself some time. You grab your lunch, come chat with me for a little bit. Tune in, and we will hit some other major topics. I haven't quite decided what we're going to talk about next time, but if you have anything that's really burning a question, we will hit that. I may see if I can get any guests to join me, and I will make sure to include that event on the page. So check back for topics, and if we're having guests, again, I hope to see you there next week. Until then, take care of yourselves. All right. Bye bye.